Hello, and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists. I'm your host, Raina Andrews, and for those of you tuning in for the first time, let me introduce myself. I'm a mother, a children's book author, a public health advocate, a TEDx speaker, and an engaged community member. Since 2021, we have been sharing the science behind today's most important health topics. Coffee Conversations is brought to you by the Advancing a Healthy Wisconsin Endowment, which is a statewide nonprofit working to improve health and advance health equity in Wisconsin. So, welcome to our virtual coffee break. This episode is one you are going to be happy you are not missing. Because did you know that obesity can increase the risk of breast cancer by up to 40% in postmenopausal women? That's a powerful connection. And today we're unpacking the science behind it. Today we're joined by Dr. Olena Klindukhova, who is the assistant professor of endocrinology and molecular medicine at the Medical College of Wisconsin, as we explore the biological links between obesity and breast cancer and dive into practical strategies for nutrition, movement, stress management, just in time for the holiday season. Whether you're looking to make informed health choices or simply curious about the science shaping our lives, this conversation is brewed to inspire you. So welcome, Dr. Klindukhova.
All right, Ryan. Well, thank you for your kind introduction. I'm very thrilled to be here. Organizers, this is a very great opportunity for us to share the medical knowledge and make public aware of this great, well-known association in the scientific world, but underspoken, underrepresented in the general population. And we're going to share the science, and we're going to share the things that we all can do to reduce the risk of breast cancer.
Well, you've heard it from Dr. Klindukhova. We have a very busy program for you today. And because this is live stream, we encourage you to engage by dropping your questions in the chat. So let's get into it. So just to create a baseline, Dr. Klindukhova, can you help us understand what do current statistics tell us about the intersection of obesity and breast cancer?
Absolutely. Breast cancer is the second leading cause of cancer-related death in the U.S. women. Approximately 1 in 8 women, that is 12% in the U.S., will develop invasive breast cancer over their lifetime. The prevalence of female obesity is on the rise. It was calculated to be over 40% in 2024, according to CDC data. Will be a link in the chat that you can further go in and explore and get a little bit more statistics, more information about this. Both of those are pandemic conditions. There is an inverse correlation between physical activity and breast cancer incidence. That is, greater physical activity reduces risk of breast cancer. There is also a positive association between obesity and breast cancer in women of 55 and older, meaning the higher the weight, the higher the risk of breast cancer. Women with higher BMI at risk for breast cancer recurrence and overall mortality.
So help me understand this. So you're saying that breast cancer is the second leading cause of cancer related to deaths in U.S. women. What is the primary cancer that's leading before breast cancer?
So it's a fighting battle between the colon cancer and the lung cancer.
Oh, being number one.
Yeah.
Wow. This is a powerful intersection, especially as you talk about BMI and the growth of obesity in America, and the fact that there is a connection between this growth in obesity or the increase in number of obese persons in America, particularly women, and an increased rise of cancer in America. Can you explain the biological mechanisms that connect obesity to breast cancer risk?
Adipocyte, those are the scientific names for the fat cells. They're not just merely fat repositories. They also act as an endocrine organ by secreting bioactive molecules. Those are called adipokines. Those adipokines have multiple biological effects. Notably, there are 3 most important mechanisms that are associated with obesity and cancer growth. The first mechanism is fat cells responsible for accelerated conversion of androgens, that is testosterone, the male hormones, into estrogen, female hormone, and that conversion fuels hormone-driven tumors. Fat cells also stimulate pancreas to produce more insulin, which leads to insulin resistance. By producing higher amounts of insulin, insulin growth factors are being produced, which will also encourage a growth of cancerous cells. And the third mechanism is the chronic inflammation from fat-released cytokines, and there is another hormone that's called leptin. Both of them will also encourage cancer cells growth. These changes create a breast environment that favors cancer initiation and further progression.
Thank you for breaking it down so clearly. That chronic inflammation, I think some women will see it as swollen hands or swollen legs or just feeling puffy, or maybe some symptoms where we may describe it. But how does chronic inflammation contribute to cancer risk?
Fat cells in women in obesity produce multiple biologically active molecules, and the group of those molecules, those called cytokines or cytotoxic molecules, and they're IL-5, TNF-I. There is a number of variety of those pro-inflammatory molecules. Fat cells are a very, very big and known source of those pro-inflammatory molecules. So these molecules that produced by fat cells, they promote inflammation. They also encourage tumor growth, as well as the growth of blood vessels that feed those cancerous cells. This further will encourage the growth and spread on the malignant cells throughout the body, and that's called metastasis.
So this inflammation contributes to cancer risk because even your the fatty deposits is almost like a breeding ground, and with the tissue and with the hormones, a breeding ground for cancer to develop. Now, the inflammation is almost like the spreading or the metastasizing of the cancer or the cancerous cells in your body. Is that a proper
It's more
understanding?
like so those inflammatory molecules, they more like a feeding like nutrients or something that will encourage cell to growth. It's those will fortify and will they promote a blood vessel growth, and blood vessels will cause encouragement of cancer cell growth, because the cancerous cells, they're not normal cells. They have a looser association between the cells, and as the more feeding or the more those nutrients are flowing to the tumor cells, the easier they are to break out and spread throughout the body.
Very, very important distinction. Thank you for that. So as you think about the connection between estrogen and insulin, I'm wondering, what role do hormones like estrogen and insulin play in that cancer development process that you just described?
Absolutely. So estrogens, as most of us do know, that after the menopause, ovaries will gradually stop producing estrogen. As a result, gradually the fat cells would become the main source of the estrogen. Fat contains enzyme that's called aromatase. Aromatase converts those androgens, the testosterone, the adrenal hormones into the estrogens. As a result, fat instead of ovaries will encourage further production of the estrogen. Those higher rising estrogen levels will encourage growth of those estrogen positive tumors that are very, very common in the breast cancer. The second important hormone is the insulin. Obesity also causes insulin resistance by stimulating pancreas to make more insulin. Fat cells also stimulate liver to produce insulin growth factor 1. Both of those, insulin and IGF-1 or insulin growth factor 1, are absolutely amazing boosters for cell growth, normal and abnormal. In addition, they also lower this what's called SHBG or sex hormone binding globulin produced by liver. So when we have less protein that binds the estrogen, then you have even more estrogen flowing around, encouraging those estrogen positive cells to grow.
This is very helpful because in the beginning, when we talked about there being a positive association between obesity and breast cancer incidences among women 55 and older. And so as you're breaking down that, women who are menopausal, who are no longer creating that natural estrogen in the body, it's then the fat cells, the fat in the body contains enzymes that then create that estrogen positive in the body, which is what's creating the tumors. Is that
That's
accurate?
exactly right. That's exactly what
Wow.
happens. So yes, normally by the age of 55, there should be very little or no estrogen produced by ovaries. And that's where the bigger the fat mass, the higher the estrogen levels. And, the weight gain post-menopause are the one that is one of the strongest predictor of breast cancer development.
This is so good. And so, as me being an African American woman, I've always been told that I'm overweight or I'm big boned, and my body type is considered overweight. Although I'm pretty active and healthy and keep a balanced diet. I'm wondering from your science, are there notable disparities in outcomes among women of different racial or socioeconomic backgrounds?
So the incidence for breast cancer in Caucasian and African American women is both on the rise. The early diagnosis actually diagnosed earlier in Caucasian. However, the mortality is higher in African American women. The death rate was up to 40% higher in African American women comparing to Caucasian. Black women had higher incidence of less favorable subtypes, particular more aggressive subtypes, which is a triple negative breast cancer. The mortality risk also substantially higher in African American women and incidence of metastatic breast cancer. In addition, low socioeconomic status also turned to be a predictor of worse outcome independently from the race. That may have something to do not necessarily with cancer biology, but with other socioeconomic factors. And there is another link that we're going to put in the chat for us to further, for listeners to further review the statistics from the cancer.org, notable statistics and important for everyone to be aware of.
Wow. So can you share more about what is triple negative breast cancer?
It's the one that is most difficult to treat, and that's the one that has negative outcome. So the speculation that earlier in the diagnosis, it responded to still the estrogen stimulation, but the abnormal cells, they kind of de-differentiated, or they become very, very not responsive to the treatment, and that's the one that tend to have higher mortality and more negative outcome comparing to other kinds, the ones that have better treatment options for even the estrogen positive breast cancer. We have better tools to fight that kind of cancer.
Okay. And so when you talk about the death rate for African American women compared to white women, with African American women being 40% higher, are you finding in your research that a lot of that has to do with early detection, that white women are catching it early so they're able to exercise greater preventative or treatment measures?
This data is a little bit difficult to tease out. We
Okay.
have different
Causation.
resources and different data, so it depends on how you kind of twist the statistics. That one of the potential speculation is the earlier diagnosis and kind of a selection bias in diagnosis. It is not clear whether African American women have different biology or of the breast cancer or a higher BMI, which is still the case. So we don't really know if it's all by means of higher BMI in African American women, higher the mortality, or there is more to the story. So that's still being investigated and discussed, and the data is not crystal clear on that.
That's very helpful. So it's not conclusive, or there's no direct causation that African American women, because of when they get tested, it leads to the triple negative breast cancer. But what the data does show that African American women have 40% higher mortality rates than white women.
Correct.
And it shows that compounding that is that low socioeconomic status is a big predictor of worsened outcomes in women than with breast cancer, independent of race. And so if you are economically disadvantaged, that plays into it. Very interesting. Thank you for sharing and helping to tease that out. So we talked about the holidays, and the holidays are upon us. So how do holiday traditions like indulgent meals and sedentary gather obesity
Absolutely.
risk?
So holidays obviously is a time to celebrate, but the statistics is, and again, depending on the study and depending on when you review, the average weight gain around the holiday from end of November till end of December is 2 to 6 pounds, depending on the study. There are some studies showing up to 10 pounds. And we used to tell patients that, well, that's kind of expected, but the New Year resolution comes. So women who gained 50 pounds or more by menopause, they have 1.5 higher risk of developing breast cancer comparing to those who maintain stable weight. So we do know that women after the menopause will gain weight. So that number varies again depending on the data. 10, 15, 20 pounds is expected. It has to do with hormone shift, changes in metabolism, and different factors. So again, women who gain more than 50 pounds, they will increase risk of breast cancer, and that's important to be aware of. Holiday habits definitely contribute to the weight gain, especially in those postmenopausal women, and that will further increase risk of developing breast cancer.
Very important. So even now, but especially those who are going through menopause, that increased weight gain really heightens your risk. I appreciate that. So I'm a woman who loves a good plan. So I'm wondering, what advice do you have for setting realistic, health-focused goals for the holidays and into the new year, being proactive about it?
There are a lot of a lot of advices that we rely on. American Diabetes Association has the most organized advices on variety of lifestyle, and they have been leaders on helping patients understand the importance of good and healthy holiday traditions. The holidays is the time to eat, drink, to be merry. However, eating and drinking sugary foods and drinks can make it challenging and not only manage the weight but also the glucose. So ADA recommends 7 tips. Okay, number 1, prioritize self-care. Number 2, if you are having a potluck or you're having multiple gatherings at work, friends, family, bring your own dish that is healthy. American Diabetes Association has a number of holiday recipes with much better, healthier choices with lower amount of those sugary and fatty ingredients. Do avoid skipping meals. So don't treat yourself, oh, I'm going to eat a big dinner and I will skip breakfast and I'll be okay. It doesn't work that way. Practice mindful eating over mindless eating. Make a holiday meal about experiencing favorite food, not stuffing yourself, not overeating. Very, very important. There are multiple tips that American Diabetes Association has to practice the mindful eating. Plan your plate. So the ADA a few years back changed the plate to a 9-inch plate on which half of the plate would need to be non-starchy veggies. Okay, so please enjoy your spinach and green beans. Quarter of the plate, make it carbs, and quarter of the plate, make it a protein. Always plan your drinks. Avoid sugar-containing beverages. And more important, move after the meal. Make sure you plan a walk. Make sure you plan some kind of physical activity during the celebration. We're going to put another link in the chat to diabetes.org to learn a little bit more about this tips for holidays, and there is a lot more information that hopefully you will find helpful to stay healthy through the holiday season.
I absolutely love this list, and I'm happy to see that our family does quite a bit of this where we lead with veggies, so that's great. And so we eat our veggies and our protein first, and then we treat ourselves to our carbs. And what I started doing 2 years ago is that I love sweet potato pie. And so I would eat that early we eat Thanksgiving pretty early, and I'll eat that early with our dinner. And if I feel the need to have some dessert later, I just say, I had it earlier, I had my sweet treat and move on. But my husband and I have gotten into the habit of going for walks after all of our meals to really help our food digest. And we've incorporated that for our younger son as well. So really, really good advice. So now we're going to turn it over to our chat, and our chat has been very chatty. So, Dr. Klindukhova, we've spoken just quite a bit about how weight gain connects directly, or obesity connects directly to cancer growth. Can you talk about what BMI is considered obese? Someone's asking.
Yeah, so well, there's still discussion whether BMI is the right measure in the scientific world. BMI is the easy measurable number that's used in the study. However, there is a lot of data that may be a waist circumference predictor of obesity and obesity-related complications. It's a little bit tricky to implement, so we do still BMI data. And BMI, the reason BMI does not fit all, for someone who is more muscular or someone who is more bodybuilder, that BMI may not apply. So every time we have those numbers for BMI, we do need to take it with grain of salt and make sure that this particular person doesn't have those numbers that outside. But generally, BMI of 25 to 30 considered to be overweight, and greater than 30 considered to be obese.
That's very helpful, that range that you provided. So GLP-1s seem to be all the craze. So this one viewer is asking, what about the use of GLP-1s in breast cancer survivors to help with obesity in postmenopausal women? Or are the use of GLP-1s to address obesity and lower cancer risk?
That's a fantastic question. So MCW may become one of the sites to further gather that scientific information. So this question has been risen, and a lot of researchers are trying to collect the good data. So the theory, we would speculate that yes, as we lose weight, we would see decrease of multiple cancer risk. And small data do have those little signals. However, The cancer biology is as such, it will take much longer period of time to see the impact of GLPs that have not been around long enough. So yes, there are a lot of theories, there are a lot of discussion, the data is being gathered. We don't have the good solid evidence, yes, but everyone look very optimistic that as time will go on, we are going to start having those positive results associated with GLPs, and this will empower us to use even more, not only for traditional obesity and obesity-related complications, but beyond, and to expand it into the cancer prevention world.
Got it. So to be determined, much to still be studied here. So we talked earlier quite a bit about estrogen and insulin. This particular viewer is asking, does an excess of estrogen or testosterone in a woman increase or decrease breast cancer incidence?
So both excess estrogen and testosterone will increase risk of breast cancer. That has been shown, and promoting the growth of the promoting the growth of cancerous cells. Again, so someone who takes HRT, that is hormone replacement therapy, and the women who never seen this significant estrogen drop after the menopause, those women don't seem to have increased risks. So only breast that has seen much lower or no estrogen level, and at some point the estrogen level starts going up, and same for the testosterone, by the means of that aromatase that converts testosterone into estrogen. So those women that had a good pause or good long stretch of not having the estrogen, and estrogen starts rising into a super physiologic or much higher levels, in addition to other risk factors, obesity that been shown to increase inflammatory markers and inflammatory state. So it seems like the combination of all those factors will promote cancer growth.
Mm-hmm. So the next viewer is asking, how do fat cells affect TNBC? Do you know what that is, TNBC?
TNBC, tumor
Yeah.
negative breast cancer, or TNBC? I'm
I
not.
feel like we're making alphabet soup. So let us see if they clarify that question in the chat, move on to the next one. If someone is diagnosed with excess androgynous or androgens, how can they naturally decrease them?
So the natural decrease of the androgens, again, those GLPs, or women who have PCOS, right? So modest weight loss by means of lifestyle changes, diet and exercise, will decrease natural androgen production. Also, GLP, again, in the combination with the lifestyle changes, can also further reduce androgen level, and speculating that it would reduce risk of breast cancer later in life.
Got it. And so the listener clarified, how do fat cells affect triple negative breast
Oh,
cancer?
triple
That's what
negative.
TNBC.
Okay. Right. So there is association. The tumor biology. I'm not a big expert into describing the basic principles of the tumor biology, but statistics is as such that obesity still has higher association with triple negative breast cancer.
Mm. I'm wondering, is there a blood test to have after you are done with treatment?
Uh, Done with the breast cancer treatment,
I think
I
so, to
assume.
manage
Right.
and measure your estrogen levels, your insulin, and just to make sure that you're maintaining a system, a bodily ecosystem that helps further prevent or manage your risk of breast cancer.
Yeah, well, that's a tricky one. For estrogen positive breast cancers, obviously a lot of women do take the aromatase inhibitors. Those are the for breast cancer prevention, those medications that are used to reduce that conversion of testosterone into estrogen. So when a lot of women are having to take the aromatase inhibitors for breast cancer prevention, measuring. So if someone seen the oncology and the aromatase inhibitors were not recommended based on the tumor biology, we routinely don't necessarily measure the estrogens because those other factors, again, pro-inflammatory markers, adipokines, etc., may play a bigger role in developing of other breast cancer growth. Estrogen is not responsible for all breast cancer growth. Okay, so there are multiple other factors that we discussed earlier. Insulin measurement is difficult to tease out. Insulin is very, very individualized hormone. Every person has very different insulin levels, and therefore, even outside of breast cancer, for someone who we may say this person has insulin resistance, there is no definitive specific number of insulin that we use. So it's more of the scientific speculation or basic research data, not necessarily clinical data that can be implemented in regular day-to-day.
Very well. And so, Dr. Klindukhova, we have covered a great list of questions regarding the links between obesity and breast cancer in a very short coffee break. I think just to round us out, I'm wondering what's one key takeaway you hope listeners remember from today's conversation?
Absolutely. So epidemiologic study report that only half of breast cancer survivals meet recommendations for activity and servings of fruits and vegetables. Research data reported increase in 10-year survival rate among breast cancer survival. Those who engaged in two things: 30 minutes of walking, 6 days per week. I'm sure everyone heard that recommendation. And those who in the diet have at least 5 servings of fruit, 5 servings of fruits and vegetables per day. So those two practices, regular walking and 5 servings per day of fruits and veggies, will reduce incidence of breast cancer mortality by 50%. However, mortality benefit will only be observed in women who engage in both activity. So it only going to work if someone does both.
Excellent. And with that, I want to thank you, Dr. Klindukhova, for joining us today. We appreciate you taking the time to talk with us on this important topic.
Absolutely. I was delighted to be here. There are more screening recommendations that we have and general call for action. So we're going to put that in the link for everyone to review and educate themselves on things that everyone can do to lower the risk of breast cancer. Thank you for having me here. It's a great opportunity. I was honored, and I hope so you learned something today.
Awesome. And for our audience out there, if we didn't get to your questions, feel free to send me a note at conversations@mcw.edu. I hope you all join us next month for a virtual coffee break with a scientist. Have a good day.